Good morning, everyone. And first of all, I would like to thank the Institute of Medicine for this invitation and also my colleagues from HHS, Catherine Greenlee and Edwin Walker, for making this bridge with the Pan American, between the Pan American Health Organization and the Institute. Representing the Pan American Health Organization, certainly I'm going to focus for the most part on countries of Latin America and the Caribbean. And in this presentation, I would like to give you a flavor of what is happening in the inter-American system, where a community of nations, especially Latin American and Caribbean countries, are coming together to address elder abuse from the perspective of human rights law and drafting right now an inter-American convention on the rights of older persons, where elder abuse is being mainstreamed through the whole convention as a strategy to certainly protect the rights of older persons. In this presentation, I would also focus on the links between the exercise of human rights and as a prevention to elder abuse, and the situation of human rights and abuse in a broader context based on PAHO reports and the reports of the Inter-American Commission on Human Rights and the United Nations treaty bodies. And also, I will try to cover, if I have the time, the situation in policies, plans, and laws in Latin America and Caribbean, especially regarding long-term care facilities for older persons, the exercise of rights and elder abuse. And finally, the PAHO recommendations that all governments of North, Central, South America, and the Caribbean have put together in the plan of action to reduce elder abuse and to promote and protect the human rights of older persons. So just to put my presentation in the context, in the past 10 years, there have been a fascinating development and participation of the governments of Latin America and the Caribbean in the Organization for American States in order to address elder abuse from a human rights perspective. And I just want to focus on three latest resolutions on the human rights of older persons, the resolutions of 2009, 2010, and 2011, where the General Assembly of the Organization for American States concluded that there are many dispersed laws in Latin America and the Caribbean where elder abuse and the human rights of older persons are not addressed properly. There are lack of studies and reports about the violations of human rights which contribute to elder abuse. And in 2011, for the first time in the international law system, some member states decided to create a working group to draft the Inter-American Convention on the Rights of Older Persons and to address the rights of older persons. Certainly, this group that is meeting right now, it has been meeting since 2011 and will conclude its work in 2 weeks, is for the most part represented by Antigua and Barbuda, Argentina, Brazil, Chile, Dominican Republic, Dominica, Costa Rica, Nicaragua, Panama, Ecuador, Mexico, Jamaica, Uruguay, and Venezuela. And basically, these member states, these governmental officials, are bringing to the negotiations the reality of their policies, plans, and laws on aging, and trying to address in this draft convention all these flaws, including elder abuse, in their national instruments, and hopefully will present to the General Assembly of the Organization for American States a final convention that will address all the human rights of older persons in the Western Hemisphere. Now, as an advisor of PAHO, certainly, and when we visit countries and long-term care facilities for other persons, we rely on international human rights law reports that certainly are reports that the Special Rapporteurs on the Right to Health and also the General Assembly of the United Nations have put together when visiting countries. And these reports, especially the report of the General Assembly of 2011 and the report of the Special Rapporteur on the Right to Health of 2011 also have addressed the issue of elder abuse, referring to elder abuse as, in many countries as an experience that is threatening the right to life, the right to health, the right to liberty and security of older persons in care facilities and also in the community, including violence against the women and violence that is the result from traditional beliefs, as was stated this morning regarding especially the African region, and violence also against older women that encompasses physical, sexual, psychological violence and financial exploitation, and in some occasions is perpetrated or condoned by the government. And this is in a summary what these two reports have stated. These are global reports, so certainly are presenting the situation of the different regions of the United Nations. Now, going back to the Inter-American system and the Pan-American Health Organization. In 2009, all PAHO member states, including Canada and the United States, approved the Plan of Action on Aging, which is a fascinating plan of action because it's not only a public health plan of action. It's a plan of action that is rooted in international and regional human rights treaties and standards. And all PAHO member states endorsed the three links among elder abuse, human rights, and healthy aging. These links are based on the work of Jonathan Mann, that, as you know, was an HIV specialist that back 20 years ago began to link public health with human rights. The first link is that violations of human rights can contribute to elder abuse and negatively affect the health of older persons. So we see elder abuse in a broader context, in the context of exercising or not human rights and liberties. Then the PAHO member states endorse that policies, plans, and legislation on aging can contribute to protect human rights and prevent elder abuse if these policies, plans, and laws are formulated in a manner consistent with human rights obligations. And then a third link that is a fascinating link because it never ends is the synergistic relationship between exercising human rights and healthy aging. Human rights are essential for enjoying healthy aging, but healthy aging also, when a person enjoys health, then is in a better position to exercise all human rights. So this is the fascinating link between health and human rights. Then what I would like to do now, and hopefully I'm going to have the time, is to give you an idea of, number one, what are the rights that countries of Central, South America, and the Caribbean are putting together in this draft convention in the OAS. Also give you some examples of what are the flaws that still we find in policies, plans, and laws on aging in Latin America and the Caribbean that is affecting the exercise of the rights that you have on the screen, but also give you some examples that are coming from the decisions and reports of the Inter-American Commission on Human Rights and the Commission on the Elimination of Discrimination on racial discrimination, which addresses discrimination on indigenous peoples, Afro-descendants, and Romani populations in Latin America and the Caribbean. Of course, each committee of the UN and the Commission analyzes close to 30 or 40 decisions per session, so I'm not going to have the time to give you all the observations of these reports, but I want to give you some flavor of what is happening in national policies, plans, and laws. The right to equal protection of the law being affected right now because most of the laws in Latin America and Caribbean lack procedures to review periodically guardianships in cases of disability or incapacity. And of course, that security of indigenous elders in indigenous communities also is affected because there are lack of access to potable water and sanitation due to mining and constructions of roads in many of these countries that affect older persons in indigenous communities. The right to personal liberty and security of person that is affected also when older persons in indigenous communities are forced to leave their lands due to constructions of the government, such as airports and roads. Other issue that is at stake in these national policies, plans, and laws in Latin America and Caribbean is the no discrimination on the grounds of age, that these provisions are lacking in some of these laws, especially affecting work pensions and education, the right to life and freedom from violence, practices such as experimentation on older persons without consent that sometimes are happening in some indigenous communities, the right to personal integrity and freedom from torture. For example, there are lack of national regulations on palliative care that has implications on pain and the right to personal integrity. The right to freedom of thought and expression. And some member states in this working group have been discussing during these months how to improve the access to information for older persons, information on sexual health, information for LGBTI health and older persons who are LGBTI. Other rights that are being included in these Inter-American conventions are the right to privacy, the right to dignity and security in long-term care services, because still in many countries of Latin America and Caribbean, there is a lack of national laws that regulate the admissions and living conditions in long-term care facilities for older persons and the procedures on informed consent. The right to judicial protection, the right to vote, the right to a fair trial, and the right to the highest attainable standard of health. And of course, representing PAHO, this is a right that is in my heart, is the right to health. And in many of these countries, and what is being discussed in this working group in the OAS, is that it's necessary to create policies and laws that can facilitate access of older persons to health services, also information on their own language, because many of these communities do not speak Spanish, they speak indigenous languages, and information is not in that language. And also there are barriers for the right to health when public health personnel speak Spanish and not indigenous languages, which is a barrier for the right to health. Then, with regard to what the working group has been discussing, or in order to address elder abuse in the context of human rights, one concern for this working group, and that the convention will reflect, is where this elder abuse occurs and where these restrictions of human rights affect the health of older persons. And the group is considering private and governmental institutions, private and governmental community-based programs, private and governmental residential programs, and older persons deprived of personal liberty in prisons. So all these areas are being covered by the convention, by the draft convention. Then very quickly, and this is a very important part of the convention, I would like to refer to some of the flaws in policies, plans, and laws that the convention is trying to regulate in the context of elder abuse in long-term care facilities, taking into account the situation of Latin America and the Caribbean. And the group is discussing now the right to a dignified life and personal integrity, and why this particular right in the context of long-term care facilities. Because still there's measures to protect older persons are lacking in the context of protection against seclusion, restraint, malnutrition, sexual and or financial abuse, physical abuse by health personnel. Example, older persons forced to eat meals that they don't like, or are locked up or tied to beds, or are placed in physical positions that could affect the physical disability or cause wounds. And this has a direct impact with the right to a dignified life and personal integrity. Other right that is being discussed by the working group is the right to mental integrity. That in the reports that we have been analyzing from different countries of Latin America, Caribbean, and the Inter-American Commission on Human Rights, we still see reports on threatening of older persons with abandoning them by the health personnel, intimidation of older persons with words or gestures, and deplorable living conditions in rooms, and also abandoning older persons being forced to be in bed. Just some examples of what these reports show. The right to security of person is another right that is being discussed in this convention. especially in the context of the participation in the decision-making process for informed consent to treatment without threats, medical scientific experimentation without consent, right to a periodic review of any decision that refers to lack of legal capacity and or procedures of appointment to personal representatives as a consequence of that incapacity. And the draft convention is including specific provisions that are lacking in most policies and laws of Latin America and Caribbean about the periodic review of the legal capacity of older persons and the exercise of human rights and the review of guardianships. The right to equal protection of the law. The convention is discussing also, and the member states are bringing concerns about the lack of norms for the recognition of older individuals as persons before the law, participation in committees within long-term care facilities, the right to make decisions in long-term care facilities according to their own preferences in order to guarantee autonomy. These practices and these flaws sound very simple, but in reality, the reality of Latin American and Caribbean countries, the majority of laws and policies are not even considering these issues regarding long-term care facilities. And finally, the freedom of expression is another right that the working group is discussing because it's lacking policies and laws that guarantee all information about the fundamental rights and mechanisms of protection for older persons to prevent abuse, freedom to communicate with other persons in the long-term care facility, to receive uncensored private communications, freedom to communicate with counsels or personal representatives, access to postal and telephone services, newspapers, radio, and television. We have gone to countries where in these long-term care facilities, all these rights are practically restricted because there is no contact with the exterior world, TV, radio, newspapers, etc., which is part of the right to freedom of expression. And finally, the right to judicial protection and judicial guarantees is a right that is right now being discussed by the working group. And key elements of this right that will be included in the convention are the periodic review of appointments of personal representatives, guardianships, admission procedures to residential programs, informed consent procedures in the context of treatments, hearings before review bodies, and appeals before ombudspersons and national courts in the case of elder abuse petitions or also other types of restrictions of human rights. And the last section of my presentation, hopefully I can do it in 1 minute, is what to do. The plan of action of PAHO of 2009, approved by all member states, gives us some objectives, lines of actions, activities, and indicators in order to prevent elder abuse and to protect human rights and health more effectively in the Western Hemisphere. So I'm going to summarize what are some of the actions that PAHO is proposing in collaboration with civil society, judges, parliamentarians, the media, ombudspersons, and universities. Formulate policies, laws, regulations, programs, and budgets consistent with the United Nations and the Inter-American Human Rights instruments that I just mentioned. And this is going to be one of the main objectives of the Inter-American Convention on Human Rights for older persons. The dissemination of all the human rights norms and standards in the community and among governmental workers. The development of legal frameworks and implementation of mechanisms to protect the health and human rights of older persons in long-term care facilities. With the support of PAHO, ombudspersons in Central, South America, and the Caribbean are now visiting long-term care facilities. Never in the past, ombudspersons visited long-term care facilities for older persons. They were visiting prisons, but not long-term care facilities. So this is another area where PAHO is supporting member states. The development and implementation of programs to train relevant actors in the formulation of legal frameworks and policies on aging. We are working very closely with parliamentarians in Central, South America, and the Caribbean that for the first time are putting together the law, human rights, and aging. they have been very concerned about other areas of public health, but not aging. Also, another recommendation of PAHO member state is to upgrade the competencies of personnel in delivering health services to older persons, providing training that include not only public health tools, but also all the human rights norms and standards that governments have accepted. And finally, PAHO member states in this plan of action are recommending to regulate the delivery of care in long-term care facilities for older persons with a special attention to measures to guarantee autonomy, care to the terminally ill and chronic patients, pain control in order to protect the right to personal integrity, physical and mental integrity, and also palliative care that allow the terminally ill to die with dignity. And palliative care is one of the major developments of this draft Inter-American Convention. For the first time, there will be an Inter-American instrument that will help countries to formulate laws and policies that would include palliative care. These provisions are lacking, for the most part, in most policies and laws of Central, South America, and the Caribbean. Of course, in that convention, palliative care is explained in the context of the right to live with dignity, the right to personal integrity, the right to health, and the right to equal protection under the law. So this is the end of my presentation. Thank you very much. This is the way PAHO is trying to support member states to protect more effectively the rights of other persons and to prevent elder abuse. And certainly is not a work that is done only by PAHO. As you can see, involve a movement of countries, of civil society organizations, of all the branches of the government. And I just want to finish saying it's a great joy for me to see my colleague Alex Calache, because 10 years ago, when we were going to countries to speak about the possibility of an Inter-American Convention on the rights of older persons, we had rooms with 3-4 people. And now is a movement in this Western Hemisphere of governments and civil society that is very concerned about elder abuse, human rights, and aging. So I think that we really need to take advantage of this moment. And thank you so much to the Institute for providing this space to speak about human rights and aging. Thank you so much.